Hello, this is Dr. Natasha Kelly with Equitable Healthcare. Today we're going to talk about women's health, and I'm going to talk about a little bit about my experiences and as a patient, and then describe what my patients told me over the years. So, unfortunately, women are still very stigmatized. This concept of implicit bias, I don't find there to be any implicitness in it actually. It's just to me florid discrimination and bias, especially psych out bias and gender bias. So, woman, we're going to leverage telemedicine. I think black and indigenous women are treated the worst in terms of we're ignored, dismissed. Um, it's as if we're either drug addicts, alcoholics, or we're crazy. We have schizophrenia, schizoaffective disorder, bipolar, and even then, you can't discriminate. The patient cannot perceive that because of their disability, they're treated differently. This is a violation of the ADA Act, so American Disabilities Act. So for women, I am going to encourage you to file discrimination cases with the CHRO, the Commission for Human Rights Opportunities in your state. The more we file, the statute of limitation is 6 months. So once you've been exposed to discrimination, normally I call it the Indiana Jones Temple of Doom ball that just keeps rolling. They keep repeating these diagnoses, and you're easily misdiagnosed and placed on unnecessary medications. So we have to create precedents, right? And that's what I was told, that there was no precedence for my case. But we have to create precedents. So we have to file cases, and you have 6 months from when the incident occurred. Trust me, by the third month, you will know that you're being discriminated against. And if you have any follow-up to do, specialty follow-up, do not go to that healthcare organization. Find another facility, because this documentation is going to keep rolling in your chart, and it creates a lot of discrimination and bias. So the number one way to take care of yourself, a woman, is preventive medicine. Once you start having your menses, you should go on, for me, a potent multivitamin, take magnesium, vitamin D3, evening primrose oil, and if you can, vitamin C. If you have chronic disease such as endometriosis, adenomyosis, PCOS, it's a deeper dive. For those chronic disease, I recommend the use of therapeutic medical cannabis. Um, Most states allow medicinal therapeutic cannabis. So I work with LeafWell, so I recommend going to the LeafWell website and getting a medical cannabis provider to recommend medical cannabis for you. Um, Women tend to do this superwoman Gal Gadot thing, but you have to return some of the self-love and self-care to yourself. And as you get older, especially when you become perimenopause and menopausal, it's more self-care. You have to exercise, even if it's standing exercises, 3 to 5 minutes twice a day. For me, I recommend reflexology, um, 3 to 5 minutes a day, standing exercises 3 to 5 minutes a day, twice a day minimum. You have to massage, you have to become your own masseuse and reflexologist. You have to massage the areas twice a day before you shop, before you do any of these increased activities of daily living. You should treat your pain, and do not gaslight yourself. I see it a lot in my medical cannabis patient. Oh, the pain is not so bad. It is bad, and it's easy to end up with a stroke or heart attack from that level of stress, that adrenaline surge, and the cortisol is so high. You're gonna gain weight. It's gonna be hard to even lose weight. Medical cannabis again is excellent for not gaining weight. So for my menopause woman, medical cannabis, you can use Climara Pro to help you basically balance your hormonal fluctuations. The best nutrition is a green mind diet. Green stand for green tea. I normally recommend that you add 1 to 2 teaspoons of organic cinnamon, and there's also something called bona fide bee pollen. My acupuncturist told me about that. That works really well. Acupuncture works really well with or without moxibustion. You may need alternating Chinese or Japanese alone. Whatever works for you works for you. And just remember that you have to do a maintenance therapy. So sporadicness does not work because you're being injured every day. Every day you're being injured by the menopause. Menopause can go on for 5 to 10 years. Some women go into psychosis, so you have to work really hard, spend the time. It's 6 to 10 hours of self-care. For me, even the main component of exercise that I recommend outside of the standing exercises is aquatherapy. So you go in water 2 to 4 times a week, and I recommend foot detox ionic spas, 2 times a week for 4 weeks, and then weekly for 3 months, and then you can spread it out. But the ionic spas really detox the body pretty well because, as I said, you're getting injured. Life is injurious, the battlefield of life, with all the landmines that you sometimes cause. You have to minimize the landmines in your life. So be decisive, do your pros and cons or your SWOT analysis, and pray and speak to your, how I was raised in Jamaica by my grandmother is to speak to your oracles and the architects. Don't make decisions. I don't make any decision without speaking to what I call my acuity team. I have a 10 team support team basically that I make decisions with, and then in that 10 team of people, I have 5 people who I can talk to 4 to 6 times a week. So just take care of yourself, practice self-love, and be kind to yourself and be patient with yourself. And if you break down, everything break down. That I shouldn't say unfortunately, but women are the backbone of every family. The I call it the glue, the gumminess, are women. So we have to take care of ourselves, and so that we can take care of everybody else. And behavioral health is extremely important. I am not a fan of talking to family members and friends and stuff like that. You will know that you have enemies instead of friends. But pick your team. I have a life coach, a business coach, I have advisors, I have a spiritual mother and a spiritual father. So I recommend you have a team of professionals that you talk to. I think the Office of Inspector General, they're allowing licensed social workers to be like the center of the team instead of physicians, which I think is very important, especially with the advent of COVID and the behavioral health issues, and teenagers and children just feeling disconnected from life and feeling alone and lonely. We have to do a better job teaching them to speak to someone. Like suicide is not an option. Just the sun will come out tomorrow. You just have to talk to somebody. This is a moment in time that it's easily overcome by just talking to somebody who understands what you're going through. And to that point, in my preventive medicine protocol, I send patients with PTSD, anxiety, and so forth and so on. I send women to a peer support counselor, another woman who had anxiety, who had PTSD, who had the loss of a child, who had the loss of a parent. It's a different sensibility, compassion, empathy, consideration. And for my patients, I always tell them that when, my idea of psychotherapy, meditation, affirmation, and mind body exercise and techniques, when it's working, when your peer support counselor is working, when they're talking to me, Dr. Kelly, I feel so much better, it's because your endorphin is going up. So you have to feel that feeling of calm, peacefulness, or zen, or that you feel like you're floating. It's, this happiness, or this, your mood is just greatly improved because your energy is becoming lighter. And even that concept, again, of maintenance therapy, that for me, my patients have to spend about every 2 hours, they have to take a break. I call it the cacophony of mama and the noise of the world. You have to distract yourself, well, detach and purge all during the day, because there's no way you're going to be able to sleep at night. You're in pain, you're going to have insomnia, you're going to wake up. And to that point, to develop what I call a sleep hygiene regimen. So this is, I do a four-point approach. This is self-care, is work, and it's maintenance therapy so that you don't have a stroke or a heart attack. And for Black, brown, and indigenous women, we have to do a better job with preventive medicine. That's what I'm getting, telling the four-pronged approach how to do it. So my approach is psychotherapy, which you do yourself, meditation, affirmation, mind body exercise or techniques, a minimum of twice a day. You have to do reflexology in that as well. Local regional therapy through reflexology to any point in your body and your brain, which I call local regional psychotherapy. And then number 2 is good nutrition. I use a green mind diet, again, green tea with 1 to 2 teaspoons of organic cinnamon. Number 3 for me is excellent sleep hygiene. Notice I didn't say good. Excellent sleep hygiene. So go on YouTube and pick best practices for sleep hygiene and develop a regimen for yourself. And number 4 is exercise. You have to exercise. So my woman, menopause, endometriosis, fibromyalgia, rheumatoid arthritis, you have to treat your area, do your local regional therapies, do your reflexology, and then exercise, then go shopping. But the best exercise is aquatherapy because of the level of overweightness and basically obesity in the population. I have to decrease your weight because your weight is a part of the injury, relative to the adipocytes. They call them now endocrine organs, that they're giving out all sorts of inflammatory mediators. So your pain is going to be worse. Anxiety, PTSD, fibromyalgia, Crohn's disease, all these things we have to control. And the green mind diet is green Mediterranean, and the dash, those two let you use weight. And I also use, in my preventive protocol, I use juicing, organic carrot, beet, and ginger, at least 1 glass a day. So my patients lost 3 to 5 pounds a week on that regimen, because I change your gut microbiome, which is very important in women's health. A high school friend of mine reached out to me and was saying, oh, I have endometriosis. And she said, just using the probiotics decrease her pain from 100 to like 15%. I'm like, wow, that's such an impressive response. But this is how important the microbiome is relative to keeping your gut sealed and no leaky gut. So this is very important, with the good nutrition. So if you can always do these 4 things in your life, meditate, do your affirmations, do your reflexology, your local regional treatments, good nutrition, green mind diet, work on your sleep hygiene, develop a regimen for yourself, and exercise, for me, aqua therapy and standing exercises, 3 to 5 minutes without weight, you'll never have a stroke, you'll never have a heart attack. And for me, my goal is to make sure you are pain free. I use medicinal cannabis, therapeutic medicinal cannabis, but know that you have options as a woman, and that for me, therapeutic medicinal cannabis covers like so many diseases, and it's, the safest medicinal therapeutic out there relative to side effect profile if you keep the THC low. So again, this is Dr. Natasha Kelly, and just talking about women's health and how to basically prevent implicit bias and minimize discrimination and gender bias and psycho bias, and just make sure to leverage telemedicine. Unfortunately, at the moment, your best bet is to get a Black, Brown, and Indigenous clinician. um, that's just our reality at the moment, and all clinicians should be culturally relevant and appropriate, but that's not our reality. It's as if, the cadence of our words and just the tapestry, how we express ourselves, is just not, to me, deemed a part of the fabric of American society, how we express ourselves. So it's like you're talking to the wall, you're dismissed, you're ignored until you end up in the ER, which for me is a catastrophic event. So you're going to have a morbidity, which is what happened to me. The ideal is not for you to have a mortality, which is a mortal stroke, heart attack, or a mortal blood clot, which all of these you can die from. So focus on your health. Do the 4 things minimum every day. If you need a consult with me, Dr. Natasha Kelly, to optimize your health, via mainly preventive medicine and the use of therapeutic medical cannabis, please reach out for a consult, and all the information is in the description box. Have a great day, and just remember, health is the first and only wealth, and really begins in your kitchen at home. Have a great day.